Welcome to the second part of the Clinical Immunology and Physiological Regulating Medicine lesson. In this session, we will address other pathologies that are also very important and increasingly common today. Unfortunately, it is a given epidemiological fact that autoimmune diseases are increasingly widespread today. But why? There are a large variety of reasons, and one of the most important is that by living in an extremely aseptic and sterilized environment, the immune system of a human being, which is extremely reactive by nature, no longer comes into contact with common pathogens and thus unleashes itself against the structures of the body itself when easily stressed, for example, by some viral or bacterial stimulus. Hashimoto's thyroiditis is among the most common autoimmune disorders. Hashimoto's thyroiditis, or chronic autoimmune thyroiditis, is an organ-specific pathology and therefore a typical Th1 pathology that affects the thyroid gland in a very precise manner. This pathology is much more frequently observed in women than in men, and I would even say that we almost always see it in women. It happens that there are some markers of autoimmune thyroiditis, or there are some markers of systemic lupus epidermidis, so that, in other words, in a woman that has this type of hyperactive immune system, there's almost always a risk of disequilibrium and, therefore, an autoimmune disease. What is the etiopathosis of Hashimoto's thyroiditis? The first cause is quite often an external stimulus. The external stimulus may be an excessive consumption of iodine in the diet, and while we know that iodized salt is useful for preventing goiter, it can also be extremely dangerous because it can be pathogenic for Hashimoto's thyroiditis, as it can inflame the thyroid gland if it is present in excesses, causing ruptures in the tissue that in turn stimulate the production of autoantibodies. Or it can simply be a viral inflammation. For example, we have seen the Epstein-Barr virus, or a venereal bacterial inflammation that, due to its anatomic contiguity with the thyroid, leads to a small inflammation, a small rupture of a part of this gland, by which some thyroid structures are exposed and the body develops antibodies against these structures. Autoimmune thyroid disease is thus triggered and can be seen increasingly in young people as well. We therefore see that what was once seen in women of 40 to 45 years of age is also observed in girls. Hashimoto's thyroiditis should therefore be investigated. It should be evaluated because the earlier that it is expressed, the greater the damage will be, i.e. the damage caused by insufficient thyroid function secondary to thyroiditis can be extremely serious for the growth of the body, the development of the nervous system, and the body's metabolism.
Estremamente importante.
Another autoimmune pathology that also involves the thyroid, and that we can see frequently, even if not as frequently as Hashimoto's thyroiditis, is Graves' disease. However, we should remember that Graves' disease is a Th2 lymphocytes-mediated aggression. It is therefore very important to distinguish if one is dealing with Hashimoto's thyroiditis or Graves' disease, as these situations are often confused with each other. The two situations clearly have completely different treatments because in Hashimoto's thyroiditis, we have a destructive stimulus on the cell caused by interferon gamma, and in Graves' disease, we instead have a stimulus of interleukin-4 and interleukin-10, particularly the effector interleukins of Graves' disease. Interleukin-4, 4C, and interleukin-10, 4C, are therapeutic in Hashimoto's thyroiditis, and the effector cytokines for Graves' disease are therapeutic in Hashimoto's thyroiditis. So the concept is very interesting. There is a sort of thyroid balance that allows us to carry out an extremely re-equilibrating therapy. We should recall another very important aspect, namely that Hashimoto's thyroiditis must be evaluated on the basis of age of onset. For example, if we are primarily young subjects, Hashimoto's thyroiditis in a girl or a woman is much less dangerous than Hashimoto's thyroiditis in a man or a boy, which, although much less frequent, is nonetheless much more dangerous. In fact, in the male, in addition to an activation of interferon gamma, there is also a typical activation of interleukin-6. The simultaneous presence of interferon gamma and interleukin-6, which is typically found in the male subject, leads to the possibility of thyroiditis, leading to thyroid cancer, and therefore, a thyroid nodule in a male is to be investigated with greater care with respect to a female thyroid nodule, precisely because we know about this type of progression.
Con maggiore attenzione rispetto al nodulo tiroiditico femminile, perché sappiamo di questa tipo di.
Another very important aspect to consider is that today we see iatrogenic thyroiditis. For example, there are drugs whose molecular structure contains iodine atoms, such as in the case of amiodarone, which is used for cardiac erythesis and is a drug that can cause serious damage to the thyroid and is one of the causes of iatrogenic thyroiditis. Therefore, what is the basic therapeutic approach that we have to take for thyroiditis? In a certain sense, we have to protect the structures around the thyroid. Therefore, during the suspicious stages in which we fear that Hashimoto's thyroiditis could develop, we have to work hard and as early as possible with tonsillitis compositum, 1 vial orally 2 times a week, to prevent a trivial tonsil infection from being subsequently transformed into chronic thyroiditis. The extremely important drug in this context is Guna Lympho, which will provide that important drainage that allows the tissue to not soak itself in inflammatory factors. If Hashimoto's thyroiditis occurs in a subject with extreme immune eretism, particularly in a female subject, it is worthwhile to rebalance this tendency with Guna male drops. I repeat that cyclotin that we will use for Hashimoto's thyroiditis will be interleukin-4/4C, which is a Th2 cytokine with a trophic effect on tissues.
L'interleuchina 4, che è una citochina TH2.
Finally, what is the problem with Hashimoto's thyroiditis? It's that the thyroid tissue is generally destructed over time, and over the years the thyroid becomes atrophic and heads toward hypothyroidism. So interleukin-4/4C has a protective effect on the thyroid structures and therefore protects from a progression towards thyroid atrophy and from the need for replacement therapy with thyroid hormones. If instead we are faced with Graves' disease, which is found more frequently in male subjects, we should intervene with a different interleukin, which is interferon gamma-4C. It is therefore important to give the utmost importance to the differential diagnosis of thyroiditis.
Della tiroidite.
In the field of autoimmune diseases, a position of great importance, unfortunately, is represented by multiple sclerosis, which is an extremely common disease today, and therefore will be much to say on the possible epithogens of this disease. We will just point out that this disease is a relatively recent one that did not exist 60 to 70 years ago. Some see a possible connection with the existing trend in civilized countries and also throughout the world to vaccinate. There is, therefore, a possibility that multiple sclerosis is tied to antigenic stimulation associated with vaccines. some vaccines in particular, such as the tetanus vaccine, the polio vaccine, etc.
Del vaccino del tetano, si parla
It is therefore a very complex pathology on which still little is known. What is known is that it is a disease that can be very serious for the patient, as it is a disease that causes the demyelination of the cerebral structures and therefore a damage at the central level in the brain and in the spinal cord.
e quindi è un danno a livello sia centrale.
We can use some benign cases in which the disease tends not to evolve, and quite often there may be a crisis that is easily overcome with just a little cortisone, and then perhaps it doesn't recur, and then there's a very serious case that leads the patient to a wheelchair, disability, and so on.
Sedia a rotelle, all'invalidità e così via, no?
The study of the disease's physiopathology allows us to understand when and why this disease will evolve, and in which cases it will evolve, and when instead this disease can be kept under control. And it also allows us to establish a particular and differential therapeutic strategy that is very important.
Di stabilire una strategia terapeutica particolare e differenziale che è molto importante.
Remember that we have differentiated the autoimmune diseases into localized. You will remember, for example, autoimmune thyroiditis as a typical expression of localized autoimmune disease, and into diffuse autoimmune diseases, among which systemic lupus erythematosus is typical. We can say that multiple sclerosis can be categorized as being somewhat in the middle, because a generalized activation of cytokines, both Th1 and Th2, is present in multiple sclerosis.
Multipla si colloca a metà strada. Perché nella sclerosi
It is
multipla
interesting, however, to note that when there is a hyperexpression of TGF-beta, this disease has a benign progression, and from this epidemiological consideration in the study of the disease, we make a connection for our PRM therapy.
iperespressione del TGF-beta, questa patologia ha un andamento benigno. E allora, da questa considerazione di tipo epidemiologico, di tipo di studio della patologia,
This is, therefore, the concept. In this disease, on one hand, we have hyperactive cytokines, e.g., interleukin-12, which has an important pathogenic role, tumor necrosis factor, and interleukin-4. And on the other hand, there are protective interleukins, interleukin-10, but above all, TGF-B. So, what should we do for this disease? On one hand, we have to use some basic drugs, namely Gunamatrix in particular, and Gunacell. We would use both in conjunction with each other, 20 drops of each 2 times a day, for even very long periods of time, and, especially in some patients in which a basis of endocrine imbalance can also be found, it is important to also use Gunamale to reinforce the immune system's masculine aspect. The male aspect, that is, the male hormones, protect, i.e., have a trophic effect on nervous tissue, and it is therefore worthwhile to stimulate that type of hormonal behavior. Therefore, as we said before, 20 drops each of Gunamatrix, Gunacell, and Gunamale can be administered in the same glass and in the same administration morning and evening. However, the cytokine TGF-B4C is very interesting. With 20 drops 3 times a day, it is able to modulate the severity of the disease, allowing it to pass from an aggressive disease to a less aggressive disease. Certainly, we should not exclude the fact that we may periodically resort to the administration of small doses of cortisone. But the pathology can truly be made to have a much less aggressive clinical behavior. Drops of TGF-B4C, therefore, represent a significant and extremely important therapeutic promise.
una patologia
A
autoimmune
very common organ-specific autoimmune disease, which is therefore part of this scheme, and that we unfortunately often see especially in children and young people, is type 1 diabetes, i.e., the diabetic pathology in which the immune system, which is hyperactive in an abnormal way, destroys the Langerhans cells in the pancreatic islet. It is very often difficult to intervene in this disease because the patients already arrive on insulin therapy. But if we succeed in inserting ourselves to act on the disease in its very early phase, when the patient is in the polyuria phase of initial diabetes, we know that in type 1 diabetes, there is an initial phase in which the pancreas still functions, the so-called honeymoon phase of diabetes, in which there is still some pancreatic functionality. We succeed in obtaining some extremely interesting results. We know that in type 1 diabetes, the pathogenic cyclotin is interleukin 12, and therefore the specific damage to the tissue is provoked by a Th1 type interleukin, which therefore indicates that type 1 diabetes is an organ-specific autoimmune disease.
Specifica malattia autoimmune organo-specifica.
The interleukin that we should therefore use immediately in these patients, which are often children, I have clinically seen some extremely interesting results if we are able to act during the early phase, is interleukin 4-4C. Interleukin 4-4C is the trophic interleukin of excellence. It is trophic in the context of tissues and therefore supports these cells before they degenerate completely. We therefore administer interleukin 4-4C 10 drops 3 to 4 times a day to these children, preferably before meals. Naturally, a collateral, although very important aspect is the basic therapy with Guna matrix and with the cellular support of Guna cell. Since we are often dealing with children, we have 10 drops 2 times a day of these interleukins. If they are adults, we give 20. We often add Cytomix because this abnormal stimulus of the immune system is frequently caused by viral infection. Therefore, when there is this suspicion, especially in a predisposed subject, we see that type 1 diabetes does not occur in all, but primarily in those who are predisposed to the diabetic pathology. In cases in which a viral infection is suspected, it is always better to use Cytomix to prevent possible progression. Another very common autoimmune disease tied to the use of many drugs, such as beta blockers and many others, is vitiligo, which is a skin disease characterized by an immune-type selective destruction of the melanocytes,
caratterizzata da una distruzione selettiva di tipo immunitario dei melanociti.
And the skin therefore loses its coloration and patches of cutaneous depigmentation occur and gradually spread, often on the face and around the orifices.
Di depigmentazione cutanea.
Vitiligo is a typical autoimmune disease which has been very interesting to study because there are always peculiarities that emerge from clinical research. Also, in the case of vitiligo, we have a hyperexpression of some cyclotins, which is a little confusing because there is a hyperexpression of interleukin 6, a Th2 type interleukin, but simultaneously there is a hyperexpression of TNF-A, which is a Th1 type interleukin, and therefore it is not possible to work much on the Th1-Th2 balance.
Però c'è lo stesso una cosa molto interessante.
However, we observe a very interesting element. In this pathology, there is a specific deficit of fibroblast growth factor, which is the interleukin that stimulates the precursors of all the epidermal cells.
Le cellule che sono i precursori di tutte le cellule epidermiche.
So, what happens? If in this disease we administer this particular cytokine, which does not stimulate the cells at random but stimulates a particular type of cell, namely the cells that construct all of the epidermal tissues, we go to work directly on the pathogenias that construct all of the epidermal tissues. We go to work directly on the pathogenias, which is the basis of the disease. So, FGF4C is therefore the characteristic element. 20 drops 2 or 3 times a day, or 10 drops to children. Naturally, we use Guna Matrix as a therapeutic support for vitiligo as well. Gunadermo is a very important drug for this pathology. As a dosage, therefore, we will use 20 drops, naturally 10 if it is a child, of Guna Matrix and Gunadermo together, morning and evening for a very prolonged period of time. We can also use FGF4C in conjunction with these drops and also usefully with 5 granules of anti-age skin twice a day with some extremely interesting results, because we will be working in a very clear manner as we supplement a substance that is typically deficient in this pathology.
Il morbo celiaco è una patologia.
Celiac disease is a very common pathology which is very important for us because we know that in Italy at least 1 person in 300 is affected by celiac disease. Therefore in Italy and in many other European countries such as Ireland and also in the United States, celiac disease is very common, while on the other hand it is not very common in Africa, Japan and China, and this may be due to nutrition. But we know that it is a hereditary disease and is tied to a genetically transmitted intolerance to gluten, which is primarily contained in wheat, but also in rice, oats, and so on.
Soprattutto, ma anche nel riso, nell'avena e così
The
via.
frequency of celiac disease, which is a disease that is increasing to a large degree, thus suggests that the great change that has occurred in cereals is also significant, as even if they have not been genetically modified, they have been genetically selected over the course of the last decades. And naturally, as often occurs in autoimmune diseases, not in all but in some, the disease is more common in women, as they also exhibit more immunological reactivity and aggressiveness. Therefore, what should we do for celiac disease? We must reduce the inflammatory aspect. Some once suggested that we could also substitute the diet in celiac disease. I remember a very interesting article that reported that it was possible to substitute the diet by administration of interleukin-10. However, I would say that it seems a bit daring as an argument, because we know that interleukin-10 is an immunosuppressor, and creating an immunosuppression so that one can eat pizza every day seems to be a little excessive. What is instead interesting is giving an upregulation stimulus to interleukin-10, as can be done by using interleukin-10 in the form of physiological regulating medicine and in the diluted 4C form.
Quello che invece è interessante è dare uno stimolo.
This can indeed be done, that is, the expression of interleukin-10 in the body can be enhanced and therefore the individual's reactivity to gluten diminished. Interleukin-10, therefore, has a very important role, and we can say that from 10 to 20 drops of interleukin-10 4C before every single meal can be an extremely important element for these patients, because the inflammation of the small intestine that then leads to an alteration of the intestinal villi is not triggered. It is good to complete the therapy with other types of PRM pharmaceuticals, including Ubioflor together with Guna Bowel, and both can be used with interleukin-10 4C.
Altri tipi di gocce della nostra medicina, quali sono il Guna Digest.
We should recall that since celiac disease also has moments of aggravation tied to stress, anti-age stress is, therefore, a drug to be considered for these patients. I would, however, like to make a small clinical clarification, which is that celiac disease must be diagnosed in a very careful manner, as in fact, in many cases the patient does not have true celiac disease, and this is why the diagnosis is important, since there are patients who manifest the symptoms of celiac disease without actually having celiac disease. And it is therefore important not only to provide a dosage of the anti-gliadin antibodies, but it is also important to provide a dosage of the immunoglobulins. There exists, in fact, a type A immunoglobulin deficiency, which is a pathology that leads to the same symptoms as celiac disease. But the treatment that must be carried out for this is completely different, because it is a disease that has a specific hyperexpression of interferon gamma and tumor necrosis factor, but also of interleukin 10. So while interleukin 10 is great for celiac disease, it is not good for the problem of type A immunoglobulin deficiency. In this case, the same therapy with the complex preparations will be given, but interleukin 4/4C, the trophic interleukin, will be used to an extent of 10 or 20 drops 3 times a day before meals. Therefore, you see once again, summarizing and concluding, that there is a general scheme in all of the autoimmune diseases, but it is very important to be sure of the diagnosis, to precisely understand the diagnosis and the pathology, and to carry out laboratory investigations that lead us to the improved application of the knowledge of the field of PRM, and to the consequent use of drugs as both complex preparations and individual cytokines. Alopecia is another very complex and common autoimmune pathology. And in it, we can also see various stages, and the various stages are correlated to various activations of the immune system, somewhat similarly to what we have just seen with rheumatoid arthritis. Alopecia, therefore, presents a first stage in which the typical spot appears on the head, a spot that can sometimes regress once the moment of stress has passed, namely, the moment that triggered the autoimmune disease. Sometimes, however, this spot does not regress, and localized alopecia becomes generalized alopecia. The interesting thing that we have to understand is that in localized alopecia, we have certain interleukins which are elevated. In this case, interleukin 1 and interleukin 4. And this could confuse us because the first is a Th1 interleukin and the second is a Th2 interleukin. In generalized alopecia, however, we have 2 clearly elevated interleukins of the Th1 type, which are interferon gamma and interleukin 2. This is little strange. But these are the experimental data, and therefore, in alopecia as well as other diseases, we have to understand the true nature of the disease. We see that the concept is always the same. There are some general data, and there is then the individual pathology, and the studies of the individual pathology often give us some information that may sometimes even be slightly contradictory to our Th1 and Th2 concept. However, we have to abide by a particularity of the ratio. So what should we do in terms of a therapeutic scheme for alopecia? The most important drug is Gunamud, is the drug that connects the mental and organic aspects. It is the PRM drug that embodies the PNEI concept. In alopecia, stress almost always triggers the process, and Gunamud is therefore the fundamental drug. 20 drops in the morning and evening to respect the P in PNEI, the physiological part of PNEI. We then have to work on the connective tissue, therefore Gunamatrix, which we combine with Gunamud, because among other things Gunamatrix, let's not forget, contains some small quantities of dehypernosteride, DHEA, which has an important effect on depression. It also contains small quantities of phenylalanine and tyrosine, which have an important effect on depression and therefore join with Gunamud and Gunamatrix extremely well. Then, in some cases, if we want to encourage the regrowth of the head hair, in the moment in which the immune aspect is sedated, we can also add Gunafem, because we have to stimulate the aspect of the female hormone line to work on the hair. In terms of cytokines, the discussion is complex because we should distinguish the phases very carefully. However, I would say that in principle, interleukin 10-4C can work well in alopecia, and the interleukin, in fact, acts as a brake on the inflammatory aspect. In alopecia, we should remember other drugs such as, for example, Gunafem, and, in particular, the same interleukin 10-4C, which can be administered locally, i.e. by massaging the scalp. It is massaged into the scalp in the morning and evening. On the other hand, Gunamood and Gunamatrix should be taken orally in a dosage of 20 drops per each 2 times a day. With this discussion on alopecia, which is very complex in reality, even if described here very briefly, we should conclude the second part of our lesson on immunology and, in particular, the treatment of autoimmune disease. In essence, what we have seen is that it is important to identify the immune aspect of disease, identify if the pathology is localized or generalized, and if it is an early or advanced stage. The autoimmune disease is normally localized when dealing with the Th1 pathology and is diffuse when dealing with the Th2 pathology. However, we take into account that the same pathology can pass from one phase to another. This is what we have seen in rheumatoid arthritis. We also consider that what is important is the specific study of the pathology and that we cannot apply the same scheme to all diseases. Therefore, we have now seen in alopecia how the clinical studies have led to highlight the specific cytokines that are characteristic of this pathology. A general scheme, therefore, does not exist. Rather, there exists a general concept, a clinical aspect, an experimental aspect, research, and for every pathology we therefore have some clinical concepts based on which we can provide the complex preparation. And we then have the study of the disease's specific physiopathology, which allows us to incorporate the use of the correct cytokine.